Where you are going, simply because you never knew about a life-saving eye care opportunity. According to the World Health Organization, an estimated 180 million people worldwide are visually disabled, and these numbers are expected to double by the year 2020. Many people who are visually impaired can have their vision restored by surgery, such as cataract removals. Today is World Sight Eye Care Awareness Day. The National Department of Health has embarked on a campaign to raise awareness on these issues. The department has partnered with Mediclinic Southern Africa in an initiative that aims to inform and educate the public on eye care. To tell us more about the project, we are joined by the Deputy Minister of Health, Dr. Gwen Ramokgopa. Deputy Minister, thank you for joining us. It's wonderful to have you here on Morning Live.
Good morning, Leanne.
Now, a day like this, no doubt, is a very significant day. Just talk to us about its significance, though.
Indeed, today it's a World Sight Day. It's a day where we are raising awareness to the public about the importance of looking after our eye health, but also the importance of knowing where services are, so that where, especially in instances like cataracts, where you can get help. It's in South Africa, we estimate that 0.75% of the population, which is just over 390,000, has been affected by preventable blindness. 80% in the whole world, of blindness is preventable, and this is an opportunity for all of us to work together. I've established a national task team of stakeholders, including the Ophthalmology Association, which is headed by Dr. Legodi, for a partnership between both government and the private sector, as well as a non-profit organization like the Society for Prevention of Blindness, to work towards reducing preventable blindness in South Africa.
Yeah, I mean,
since 1997, for instance, we have done more than 500,000 cataract surgeries, but we also know that diseases like diabetes predispose to also preventable blindness.
Yeah.
Today we will be at Met Forum to partner with the private sector, and we'll be doing about 10 cataract surgeries. Yesterday at Pretoria West Hospital, which is one of our sites of excellence for eye health, we have done more than 20 cataract surgeries, and in other provinces also there are all these campaigns to raise awareness and to intervene in preventing blindness.
Are people aware that there is help out there for them?
Leanne, more and more people are becoming aware, but we are also quite alert to the fact that the message may not be reaching everybody, both rich and old, but the most affected are in rural and poor areas.
Yeah. One
of the patients we saw yesterday came for the second eye cataract surgery, and it was amazing how her life has been positively impacted. She says she used not to be able to cook because when she cooked or even ironed, she used to burn herself. But now with just one eye repaired or cured of cataract, she's able to be more independent. And it's mainly affecting people above 50 and women in particular. But the message is for everybody, and we're starting early with screening of eyes, including in schools. We know that eye health also affects learning in schools where children have got visual difficulties. So it's better to screen early, and also to go to your local health facility just to check if you have diabetes and related diseases, to always check your eye health.
And I also imagine trying to convince people that it actually is safe surgery, because that, I think, is, I remember speaking to a lot of people that volunteer in the rural areas, and that's possibly one of the most difficult things, is to get them to trust you, to get them to understand that it's actually a good thing, that what you're doing. Do you still have that bus, that eye care bus that goes into the rural areas? I know you spoke about the rural areas, but is that still existing, that helps out?
Indeed, and that is why this task team of partners, some of the partners are in rural health, There are mobiles. And what we are also insisting is that where there has been a mobile service, it must work with the local health facility so that the follow-up to that patient when the mobile service has passed is done at a local clinic or hospital. So it's really amazing. Many people say, I was blind and now I see. So it is really profound impact, the cataract surgery, and many elderly people, even above 50. I mean, just imagine, I'm above 50, so there are many that are my age that can be helped.
That's fantastic.
So we are encouraging the public to go to your nearest clinic or hospital, test your eyes, and if you have diabetes and all that, remember to continuously test your eye health.
Deputy Minister, thank you very much for talking to us. It's an absolute pleasure having you here, talking about that there is hope out there and help for many people that have eye problems. So get your eyes tested. Dr. Gwen Ramokgopa, Deputy Minister of Health, talking to us about Eye Care Day. It's an awareness day, and I hope we've created some awareness about this.